back to this special edition of Free Speech Nation with me, Andrew Doyle. Today we're talking about WPATH, the World Professional Association for Transgender Health, and the leaked files that raise concerns about their procedures. Now, some of the WPATH files pertain to very young people. So here's an example of a leaked message discussing a 14-year-old trans female who started transition when she was 4. And this is a message in which the medical practitioner is saying it is very difficult to ask that they wait until age 16. Let's have a look at that. And we'll move on to another message now describing a 16-year-old patient found to have 2 liver masses. The likely offending agents were the hormones. And this leaked document, which admits that after 8 to 10 years of developed hepatocarcinoma, they died a couple of months after. Now, this is suggesting that medical staff are aware that these drugs are linked to cancer, even in children as young as 16 years old. And there's also clear cases where patients with serious mental illnesses are allowed to nonetheless consent to this life-changing treatment. So here's a doctor saying, I was surprised to find that several of my clients met criteria for dissociative disorders. And this one makes the astonishing claim, someone can have schizophrenia and be ready for surgery. So, to explain more, I'm delighted to be joined by Director of Advocacy at Sex Matters, Helen Joyce. So, Helen, WPATH produced a document called the Standards of Care. What are these standards of care?
So each area of medicine, because medicine is so specialised now, tends to have documents that are called standards of care that set out what the evidence base is, what best practice is, what the choices are. Say you're doing hip replacements, what way you do hip replacements. And there is no organisation apart from WPATH that produces anything like this in gender medicine. But the trouble is, as we heard from Mia and Michael, WPATH is not actually a medical association. I could join today if I wanted, just pay $200 and sign up and join. And in fact, many of the people who are members are not even gender clinicians, they're activists.
So we have gender clinicians, doctors going along, asking for advice, saying, I'm worried, my patient may have schizophrenia, may have a mental illness, may not be ready to give consent. And they're getting advice from people without medical qualifications.
That's right, absolutely. I looked through the entire leaked files. Michael and Mia shared them with me before the release. And I looked up who every person was. And some of those people were trans people themselves. And imagine that you're asking a question about a young person who has deeply unpleasant symptoms. You know, we heard from Mia, gross pain in the genitals. And then a trans person comes in and says, this is how I dealt with it. You can't say, well, that doesn't sound like a good way to deal with it, does it?
Of course.
It's all just mixed up, but they produce this thing called standards of care.
Yes.
Which sounds like it's got all the authority behind it that in every other area of medicine you have, but it's not.
Now, some of the new chapters in the latest version of the Standards of Care, which is version 8, they're quite surprising, aren't they?
Yes. So Standards of Care 8 came out last year in draft form. It's almost a decade, or roughly a decade, since the previous Standards of Care. And the previous ones were already disturbing enough. They marked a shift away from an attempt to provide an evidence-based clinical approach to being much more consumer-driven, what the patient wanted. But Standards of Care 8 was extraordinary. It has an entire chapter on eunuch gender identity that claims that little boys, baby boys, can be born with the gender identity of a eunuch, a castrated person. And it says that there have been eunuch-identified people for 4,000 years. What actually there have been is people like Chinese emperors and Italian opera managers who have perpetrated a grotesque human rights abuse on little boys. So that's a ridiculous claim. There's a chapter on non-binary people, which describes operations where you keep your own genitals and add fake genitals of the other sex, or remove all your genitals entirely and call yourself null. There was a chapter in the draft about ethics, but that was removed entirely.
Yes, so they've removed the element about ethics. They also removed a chapter about age limits,
So it wasn't a full chapter, but they listed some age limits that were just recommendations. WPATH doesn't have formal authority anywhere. It just has moral authority, borrowed moral authority. And they were very low and just suggested anyway. So it was things like 14 years for cross-sex hormones, 15 years for mastectomy. And they took them out because American doctors said that they wouldn't be able to get reimbursed by insurance companies if there were age limits, and they went below them. So they were saying they were already being too cautious with these ridiculously low age limits.
Now, I should say that the standards of care are freely available to anyone. They can download them online. But people listening to this will say, OK, some of the stuff that you're describing, Helen, is too far out there, right? It can't be real. And it certainly couldn't affect anyone in the UK. The NHS wouldn't be listening to this kind of thing, would they?
You'd like to think that, wouldn't you? I have to say, I think that the name World Professional Association has perpetrated an extraordinary sort of hoax on everybody. I mean, this is an activist-led document. Each chapter of the Standards of Care was developed by a committee, and on those committee are people who have no medical information whatsoever. They're just activists. So yes, the NHS, I'm sorry to say, has incorporated up to Standards of Care 7 in all the most important documents to do with gender care within the NHS. And even Standards of Care 8, this absolutely bizarre, barking mad, I would say, document which says things about eunuchs, that is referred to by some NHS trusts as international best practice. That's the expression that's always used. So whenever you hear international best practice cited by people within the NHS and in private gender clinics, what they mean is WPATH, and that's what they use as their authority for this non-evidence-based approach to gender medicine.
Now, your group, Sex Matters, have published a document called WPATH in the NHS, which has all these links and various things. But there are other websites like the General Medical Council,
That's right.
the Royal College of Psychiatrists,
Yes.
who are, even today, linking directly to WPATH.
Yes, and British Medical Association as well. All three of those do. And I think it is the General Medical Council that links directly through to Standards of Care 8. So not even the more cautious one. The Scottish Government intended to adopt Standards of Care 8 in the Sandyford Clinic. And when activists went to it, like sex-based rights activists went to it and said, look, they're talking about eunuchs. They're talking about non-binary surgeries. They ignored that until the press picked it up. And then they reluctantly rode back and just settled on Standards of Care 7.
But finally, Helen, I mean, the NHS are saying they're trying to distance themselves now, aren't they? With all of these revelations, I mean, how could they do otherwise? You'd
like to think that, wouldn't you? And I do think we're starting to see them pull back. The trouble is these things are written into their Standards of Care and into their contracts, their own contracts for services. So they need to kind of de-radicalise, go through and specifically take it out. And they need to listen to Dr. Hilary Cass and what she says.
Well, let me ask you about this, Helen. The following clip is from a training session from Dorset Healthcare University NHS Foundation Trust, featuring Dr. Christine Minnar, an NHS general practitioner. Now, in this clip, Dr. Minnar is discussing a hypothetical example of a young girl who wants to transition and answering the question, how many menopauses might this individual have?
The timeline for them would be they start periods aged 9 to 11. It's variable, obviously. The age of menarche, the onset of menstruation, has dropped over the years, and the average now is around 9 years old. At some point, if you identify as trans and you're able to access, you may, you know, if we ever have child and adolescent services that actually worked, you may actually have effectively a menopause to stop the periods when you start on GnRH analogues as part of the evidence-based way of managing younger trans people.
Helen, that's an official NHS video. What do you think about that?
I think the same as when I looked at the WPATH files on the video that Michael and Mia released, which is it's the phrase banality of evil. I mean, this is a man who's talking, a man in his 50s, talking about what I'm going through as a woman in my 50s now, which is menopause, and talking about it being appropriate, the right thing to do, something that if the NHS is working properly, it would do, to bring that into being in a 9-year-old girl, a child, a little primary-aged child, before that child even has the chance to experience puberty, let alone to know what it might be to fall in love, to want a child, to experience sexual pleasure. And this is being talked about in this bureaucratic language of monarchy, you know. I don't know how these people have so lost sight of what morals and ethics in healthcare are and what an evidence base might be. But it really needs to stop.
Absolutely. OK, Helen Joyce, thank you so much for joining me. We're going to see you a bit later on as well.
Thank you.
Now, I should say that I did contact Dorset Healthcare University NHS Foundation Trust to verify the authenticity of the clip. They replied explaining it was authentic, but they could not grant permission for us to show it. I explained that we felt it was important to show anyway, because it is in the public interest. It had already been leaked, and therefore it's in the public domain, and we are using it within the fair dealing exception to the Copyright Act. And while we don't know why they didn't want us to show this clip, it does illustrate some of the difficulties that we face in shining a light on these problems. I'd like to emphasise we've also been in touch with Dr. Christine Minnar, who wasn't available for interview today, and I'm grateful for Dr. Minnar for getting back to us, and I hope we can have a discussion on the show in the future.